First thing we want to do is talk about the why of certification. In the recent movie Lincoln, actor Daniel Day-Lewis, in his title role, is addressing his cabinet on the importance of adopting the 13th Amendment before the Civil War ends. He draws an analogy to a compass. The compass, he says, will tell you where true north is and the most direct route to where you are going, but the compass does not tell you where the swamps and the roadblocks lie along the way. For us, the Medical Fitness Association certification process is not just a compass that points north, but a GPS system, which can help you identify the swamps, the roadblocks, and will provide you with a process to discover and act upon opportunities and issues. Facility certification is an educational process, a way to learn what is working and where you can improve in your delivery of service to patients, members, employees, and your community. Facility certification is a unifying process designed to engage, educate, and build delivery confidence with your entire staff. Facility certification is a focusing process, giving you the ability to pinpoint priorities and work as a team to achieve system goals and objectives. Certification is also a leading process, a way to raise standards and differentiate medical fitness centers while preparing for the unknown outcomes of healthcare reform. Facility certification is a growth process, a way to identify opportunities for continuous improvement in your organization. Facility certification is a differentiation process, a way to formally set a path to higher standards, best practices, and outcomes. Certification is a defining process, a way to memorialize the delivery of services and experiences. Like Ken said, 6 out of 10 provider experiences are defined by staff attitude. And finally, certification is a recognition process, a way to join the growing honor roll of worldwide medical fitness centers who are committed to transforming the delivery and improving the health and well-being of the population. So what is medical fitness? How do we define medical fitness? First of all, it brings together a wide range of clinical and retail health services that help to improve the health of the population within the facility and throughout your community. Focus is always on prevention and treatment of lifestyle-related diseases, illness and injury through regular participation in physical activity, chronic disease management, and continuing health and behavior education. Medical fitness centers take a person where they are and refers or treats them as they need according to their current health status. We call this mass customization. We know that in medical fitness centers, we cater to a more mature population. Typically, the average age is 50 or older in our centers, and we know in this population that chronic disease can become a high incidence in this population. We know 70 to 80% are at higher risk, and they need to manage their chronic behavior through medical integration. Also, typically in medical fitness centers, up to 60% of the people who join have never been a member of a commercial health club before. So great opportunity to impact the 85% of people who are really not doing enough to prevent lifestyle disease. Mission drives medical fitness. Medical integrated fitness and wellness centers are mission driven. You know, we're in business primarily to impact population health management through early detection and prevention of disease, post-rehabilitation, community population and employee health management. We serve as an entry point to the health system, and as healthcare changes, we know it is changing. In the future, we believe that the medical fitness center will actually be the hub of the whole healthcare community. Also on this slide, you're going to see an example from Nuffield Health in the UK. Nuffield Health is the largest hospital system and what they call charity in the UK, and they have actually purchased and now own 65 health and well-being centers throughout the country, and this is just an example of their mission statement. Obviously, any of the examples in here should not be copied; they're just examples, but we do want to provide them to you to show you, a way to look at some of these things. So that's a little bit about what a medical fitness center is. We also know that as medical fitness continues to grow, there's going to be a need for human capital. We need more trained professionals in this field. Typically what has happened is people have been promoted because of their technical expertise, whether they're physical therapists, exercise physiologists, kinesiotherapists, athletic trainers. They've been promoted because of some kind of technical expertise that they've had. They've done a really great job with members, programming, service, things like that. And now have been promoted to a management position, and which really takes an entirely different set of service skills. So we know that through the processes of certification and the preparation of professionals, we need to give them a skill set that they can successfully operate a business and embrace healthcare delivery. As you prepare for medical fitness certification, we recommend first going through the facility standards and guidelines publication that's available through Medical Fitness.